This time I visited the dental office of Tim Chauvin and Associates to get more information about dental hygiene. Hello everyone, we're here at Tim Chauvin DDS and Associates office. I'm here with Casey Smith. She's a dental hygienist at this office. Thank you for taking your time to answer these questions. So I have a couple of questions just regarding to general dental hygiene. First one is, how often should someone visit the dentist?
It's very important to make sure you're visiting your dentist regularly. Everyone's different depending on the patient. Usually every 3 to 6 months you want to come in for a cleaning and checkup. Usually we do x-rays once a year. If someone has periodontal disease or gingivitis or any type of gum issue, it's more important to come in every 3 to 4 months, or if you build up a lot of tartar. So on the other hand, if you have normal healthy gums, every 6 months is usually fine.
Okay. And how many times per day should someone brush their teeth?
Normally twice a day is fine. Once in the morning right when you wake up, and at night before you go to bed. It used to be said that you're supposed to brush your teeth after every meal, but in actuality it's best to wait at least 30 to 40 minutes before you brush after meals. The acid level in your mouth can get higher, and then once you brush it can actually cause damage to the teeth if you're brushing too much. But if you want to throw in a 3 times a day brush in the middle of the day, that's fine as well.
Good. What about flossing?
Flossing once a day is fine as long as you're doing it the proper way. Usually at night before you go to bed is the best time.
What about kids? Should they floss their teeth?
Yeah, it is important for kids to floss. Normally whenever you're a child, your teeth are spaced out. The older you get, the closer the teeth get together just because you're growing. Whenever the teeth start to touch, it is important to make sure you're flossing those. The floss picks, those are actually perfect for kids.
Can you show us some brushing techniques and some good flossing techniques?
Definitely. And here's the proper brushing technique. When brushing, you want to take the toothbrush and angle the bristles about 45-degree angle towards the gums.
This is what 45 degrees should look like.
And you want to either do gentle circular motions or gentle back and forth motions. I normally tell patients to do circulars because a lot of people, if they're going back and forth, they tend to scrub hard. And when brushing, you want to be gentle. If you brush too hard, you can actually push the gums away and you can cause the receding of the gums, and you can also cause abrasion of the teeth. So on the top, you're going to angle up. On the bottom, angle down. And make sure you clean the back teeth as well as the top. And on the inside, you want to make sure you angle on the inside. And on the very front, it's actually best to stand the toothbrush up, and you can reach at the gum line better. Same thing with the top. Just stand it straight up and you can go like that. And then brush the biting surfaces really well also. And don't forget to brush your tongue. And you want to brush for about 2 minutes. 1 minute on the top and then 1 minute on the bottom. And another thing that is a really good option is an electric toothbrush, like a Sonicare, Philips Sonicare, or an Oral-B, Triumph. Any of the toothbrushes that are electric are going to clean more than a manual will clean. And with those, you have a different technique. You mainly turn it on and you let it do the work. Here's the proper flossing technique. You want to get about a 12-inch or so long piece of floss and wrap it around your fingers. Normally the middle fingers are going to be the easiest to floss with because you can use your thumbs and your pointer fingers to get in the back instead of sticking your entire hand in the back of your mouth. Whenever you get in between the teeth, just doing this is going to actually remove the stuff from directly in between the teeth, and that's going to help to prevent cavities. But what you also want to do is curve the floss around the tooth, go down below the gum line, come up and down, and then you're going to go to the other side, go below the gum line, and go up and down.
Remember to floss beyond the gum line on both sides. So I guess now it's my turn. Let's go at it. Casey, thanks for your time and for sharing this information with us at OT with MD.
Thank you. It was my pleasure. And February is National Children's Dental Health Month.